Hello and welcome. I'm Olga Hannanen, and this is Academia Experience. Our guest today is Dr. Elisabetta Crovara, a research fellow in human geography who works at School of Geography, Earth and Atmospheric Sciences at the University of Melbourne. She will explain how flexible work and hybrid workplaces are changing lived experiences of people with chronic health and pain conditions in Australia. Dear Elisabetta, welcome to Academic Experience podcast. Thank you for joining us today.
Hi, Olga. Thank you so much for having me. And you can call me Lily. It's shorter and a bit easier to pronounce, even though you pronounce it perfectly.
All right, Lily it is. So Lily, your project is a part of the Australian Research Council Discovery Project, How the Remote Working Revolution is Transforming Homes, that focuses on the way working from home is transforming Australian homes, working practices, and wider communities. And you specifically focus on personal and family well-being, including experiences of chronic illnesses and pain conditions. I must say that this is a rather unexplored topic in contemporary research on remote working and working from home. So could you share some insights about the motivations behind this project and its aims?
Yeah, sure. So I would say that the motivation is twofold. And it all stems from the big changes that the COVID-19 pandemic brought in. So the pandemic, on one hand, has profoundly transformed where office works get done. So one of the aim of the project is to understand, as you said, how this changing in the way we work and the places we work from, especially working from home. So how these changes are affecting the everyday lives and social relationships, household relationships as well within the home. But at the same time, also, we know that with COVID-19, we have seen the emergence of long COVID conditions, which have really highlighted, they have shed light on already existing examples of people, already existing situations of people working with and living with chronic illnesses. So yeah, within the project, we understood that it's really crucial to understand how remote work and working from home is changing the everyday lives, but also the embodied everyday experiences of workers living with chronic health conditions. And if I can explain a little bit more as well, how the intention of the aim of focusing and exploring everyday experiences of chronic illness within remote work emerged from the research. So the Australian Research Council DP project, which is a discovery project with leading investigators, Professor David Bissell from the University of Melbourne, Dr. Elisabeth Strong, also from the University of Melbourne, and Professor Andrew Gorman Murray from Western Sydney University. That team in 2023, last year, it was 2023, they launched a nationwide survey in Australia, specifically targeting people conducting paid work from home. Part of the survey asked participants about the positives and negatives about working from home. And when we went through the survey answers, we realized that some people, specifically, I think 12 people, flagged that working from home, so one of the positives of working from home, was that they were able to manage their chronic pain conditions. So without us asking specifically about health in relation to working from home, they shared that, and all these 12 participants identified as women. So this is how this research actually came up, and we found this quite significant. We didn't ask, and it came up. So that's why earlier this year, we went through and interviewed 8 of these women. and to ask them about their experiences of living with chronic health conditions, working from home, but also their chronic health histories, because working from home is quite recent. So all these women actually told about their experiences also when they had to go to the offices, because some of these conditions that they have very difficult and long diagnosis processes, which means that they're diagnosed only, some of them, they don't have a diagnosis. And the process to get one, it's very long, meaning that they didn't have flexible working arrangements in the past. And so they had to go to the office and trying to manage their chronic health condition. So conditions. I say conditions because chronic health actually emerges as usually what we call a constellations of different conditions. It's never just one. So, yeah.
I see. I found it interesting that you mentioned that only women replied or mentioned that they manage working from home with chronic health conditions. So just to make sure, the survey has been distributed both to female and male participants, right? But that's an interesting gender dimension, I would say, in this regard. Yeah.
Absolutely. Yeah. And it was actually quite serendipitous in a way, because here in Australia at the moment, specifically where I am located in the state of Victoria, the government launched an inquiry into women's pain. And the inquiry was launched in January. So actually when we started interviewing this and the scope of the inquiry, the aim of the inquiry is to really look into what medical gender bias is. So when I say medical gender bias, I'm talking about a disparity in treatment and medical care that people receive purely based on their gender. And this can range from diagnosis, treatment, and research, and as well as interactions between healthcare professionals and their patients as well. And the inquiry, just to be precise, it's specifically targets women's pain, but also includes AFAB folks, so assigned female at birth folks, and anyone who identifies as a woman, though might have a different sex assigned at birth. So yeah, it was quite serendipitous to do this research, while the state government was also asking for submission to this inquiry. And we have submitted a report based on the interviews that we have done to the inquiry into women's pain. So pretty much what we're talking about into this podcast comes from this report, coming from these 8 interviews.
And this emphasizes that your research is very, very relevant. If the government just is interested in this issue specifically, and you managed to address these issues with your research, I think that's the best thing a researcher can do in a way. So moving on with my questions, I also, when we usually talk about working from home, we think about shuffling between family commitments and work. Well, recently working from home is also a pandemic-driven change. But in your research, you find out that it's also an employment solution for people with chronic health conditions. So could you tell more about that?
Yeah, sure. I would say that it is a solution, but I will be careful with the word solution, just because it kind of frames working from home or flexible working arrangement as something easy, or almost like a prize that is given to employees. So I will look at it at working from home as one of the arrangements that people or employees with disabilities, with caring responsibilities or chronic health conditions have to manage their day-to-day health and work commitments. And I will really try to frame working from home, again, as I said, not as a luxury or a prize, but more as a right, that needs to be given to people to manage their day-to-day health and work commitment. I just repeated myself. And also, I would just correct myself because I said manage. Actually, something really interesting came up in the interviews. When I ask participants, how do you manage your chronic pain or chronic health condition at a day-to-day level when working from home or in hybrid work, hybrid office settings, almost all of them said there's nothing like management, but it's about pushing through. It's about pushing through the pain with different strategies and trying to adapt the schedules of their health commitments, like health appointments, rest, which is really important as well, with work.
I think it's an important point and a very interesting point that working from home is also a right. It's not a privilege. And that's, again, something that has not come up, well, at least I haven't seen that in previous research on working from home and remote work in general.
It is a right. It is not a luxury. It doesn't have to be framed as a luxury or a prize. At the same time, I think we have to recognize that not every job role can be performed at home. So
that's right.
It is a privilege in a certain way of a particular type of workers, or a particular group of workers as well. And I think, within our research, we are talking about digital workers, so job roles that can be performed at home. But definitely, there's this is I would say a privileged cohort of workers in some way.
I see. So, Lily, also in your research, you found out that workers or people with chronic health conditions, they often hide their health conditions. So, why is that? And how then they manage to negotiate the remote work contract if they try to conceal their health situation?
So I would say it's two things. First of all, what I was saying before about medical gender bias. So pain dismissal by healthcare professional, continuous and routine pain dismissal by healthcare professional, delayed diagnosis, or not believed about being in pain, that can lead to women especially hide their pain. So that's one thing. The other is that disclosure, it's not disclosure of a condition, of a disability, of a chronic health conditions is not compulsory in the workplace. At the same time, as you say, if no one knows if the chronic health conditions, it's not disclosed with someone at the workplace, it's very hard to get flexible working arrangements, right? But so I've asked these questions to the people that we interviewed, and most of them, they actually have not disclosed about their conditions with HR departments, for example, but usually only with one person in their team, usually the line manager. So they put a lot of trust, and most of them, they've been treated very well, but by their line managers, and they had great experiences having access to flexible work conditions, flexible work schedules. So that was great. However, some other experienced that their line manager weren't very caring. So there is kind of a disparity and an arbitrary care experiences going on, because at the very core, there is probably a distrust in the organization, a distrust to be cared by the organization, so a HR department, and probably a fear of being discriminated. against because having a disability or a chronic health condition.
I see. That's basically then case-to-case basis how a specific situation is resolved, yeah, in a specific workplace.
It's kind of like it takes away from the organization collective duty of care towards the employee, and it's very much in the hand of one person being the manager of being a good manager or a bad manager. So depending on the person that the employee has in front of them, the experience of care can be very different. Yeah.
Mm-hmm. And that actually leads to my next question, that in your report, you also emphasize that working from home can lead to stigmatization and exclusion at the workplace. So could you share some insights about that?
Sure. And that links back to what I was saying around the fact that working from home should not be considered as a prize for the employees, as a gift to the employees, but more as a right. Okay. And only when working from home is treated as a right, then teams can be remote teams can be, and remote managers can be trained to manage remote teams. While if working from home is just an elusive situation, a non-normal situation, it's very singular. So teams are not trained to work from home, and managers are not trained to care for employees working from home. So to answer your question, this was a preamble. Yeah, I've some people that I interviewed said that had very awful experiences of working from home. One, for example, shared that she was continuously prevented to access information while working from home. She was the only one of her team working from home. And also, she was required to go to the office sometimes, but she would go there and the team would almost pretend that she was not there. She would not have a desk. So she was excluded by key processes, key decision-making processes. And she just felt that she could not trust the team. So she started to second guess herself a lot. Also, imagine like your team is in the office, they chit chat among each other, they don't share key information within, messaging apps like Slack. So imagine also the isolation of this person, starting to second guess herself, and her mental health was really impacted by this situation, and actually led her to quit her job. When I interviewed her, it was she just left her positions because she could not take it anymore. So one other example about how working from home can actually lead to exclusion and stigmatization within the workplace is the case of negation of career advancement because of working from home. One person I spoke to, for example, was prevented from being a trainer in her team, even though she was a senior member of the staff and actually the most skilled. But she repeatedly asked her manager to be the trainer of new staff, also because the job role actually allowed for remote training. She learned the job she was doing through remote studying, so it was possible. But the manager said, because you're not physically present in the office, you cannot train. And this is a person with chronic health conditions and also several disabilities, which affect her mobility as well. So she could not go to the office. Yeah.
I see. These are very, well, I must say interesting insights, but also quite sensitive insights that you managed to find out in your project. I think this is an excellent contribution to contemporary studies on working from home and remote work in general. And I look forward to see your publications and future results. And I would like to thank you for joining our podcast today and sharing all these intriguing insights about working from home.
Thank you so much, Olga. Really a pleasure. Thank you so much for organizing this and for putting together this podcast. I think it's great that we can talk about our research in a more conversational and accessible way.
Thank you for listening. Check out academia experience elsewhere.